there's this growing awareness around the use of vaginal estrogen, thanks in part to people like you, among others, sort of understanding and maintaining vaginal health as women age. Can you explain how vaginal estrogen works? Why it might be crucial even for women? And I'm thinking about sort of older 30s now, right? So like maybe entering into perimenopause, not even thinking about it, maybe haven't even heard about it. So even if they're not experiencing significant sexual dysfunction or other challenges in other ways, could you speak about why vaginal estrogen is in fact so important?
Yeah. So vaginal estrogen can come in creams, tabs, rings. Those are the most common formulations. There's a multitude of different products. Vaginal estrogen is very low dose. Think of this like skincare. I call it skincare for down there.
Mhm.
Uh, and just like I had said previously, we have receptors for hormones everywhere in our body. We have tons of receptors for estrogen in our bladder, in our vagina, in our vulva, on clitoris. And most women, they're like, you tell them, you're like, that your labia minora goes away when you don't have hormones. In most women, they're like, what? It's like, yeah, you're gonna lose a body part. It might not be a body part that you look at all the time, but it's a body part that's very hormonally sensitive. And so the thing that a lot of women don't associate with menopause, aka hormone changes, is bladder issues.
Yeah.
Urinary tract infections, burning with urination, getting up at night to urinate is a very common one. Bladder leakage. All of that is because of low pelvic hormones. And you simply, I say vaginal estrogen is a bladder medication, right? You put it in
Mhm.
your vagina, the vagina and the bladder share a wall. So most experts will say vaginal estrogen for preventative health at this point, because we really have to switch the paradigm of like, why are you waiting to get sick and have problems to happen
Yeah.
before you go get treatment when we know that genital urinary syndrome of menopause, which means issues in the genitals and the bladder that happen because of low hormones. That's what genital urinary syndrome of menopause is. Happens in 50 to 80% of women, if not postmenopause, then perimenopause. That you can have symptoms of low hormones before your periods end, thus proving that the last period is actually not that meaningful as far as when can you start hormones or not.
Yeah.
Um, Advocacy for vaginal estrogen. So vaginal estrogen has an FDA boxed warning on it that says very scary things
Yeah.
like probable dementia, blood clots, high blood pressure, scary stuff. It's inaccurate. And we currently have a grassroots petition going on to send letters to the FDA. If Alec could share that, that would be sweet. There's been over 9,000 letters written to the FDA.
Yep.
And this is why it's important. First of all, truth in medicine is important. Facts are important. The risks on the label matching up the science behind it, that's important. The other thing is women who don't have access to the knowledge, they might not know. Because in a 10-minute doctor visit, you can't be like, you're going to read a package insert and it's going to be wrong. Keep
Right.
using this, right? So they'll get the product, they'll read the package insert, they'll think their doctor's trying to kill them, and then they won't use something that is incredibly safe, incredibly effective. And we know Rachel Rubin did this research. If you put every woman over the age of 65, so Medicare people, on vaginal estrogen, you'll save Medicare 1.2 billion a year in urinary tract prevention alone.
Alone. Amazing. I was actually going to ask you about this, and you have said most of what needs to be said, but you did get me thinking, because it's grassroots, how can anyone who comes across this conversation sort of best enter into that grassroots effort in getting this black box warning removed?
Yeah, so it's letstalkmenopause.org, and you'll actually see it under advocacy on that website. And you can just literally click send a letter. So they have two different options. One, if you're a doctor, nurse practitioner, like if you're a healthcare person,
Right.
you can send a letter from that. And if you're just a lay person being like, you pay for the FDA. Who
Yeah.
does the FDA work for? The FDA works for you. You pay their salaries. It's called taxes. So telling the FDA, hey, I want accurate science on the labels that you make the pharmaceutical companies put in their boxes.
Great. Thank
They
you
made
for
it very, very easy to click and send. And the reason we made it grassroots is because the doctors went to the FDA and the doctor said, please remove this label. And the FDA hasn't done it yet.
Yeah. Yeah.
Because like the FDA doesn't work for doctors,
Right.
right? The FDA works for you. And so really it's awesome that they created this grassroots, basically letter writing campaign.
Yeah. Awesome. Thank you.